Hello, I'm Brett Crocker. This is my puppy Roxy, and today we're going to be palpating a hip. Alright, so the hip's made up of three muscles. This part right here is the ilium, the top part, and on the ilium you got the iliac crest right here on the top, and you move to the front, you're going to have the anterior superior iliac spine, and then you move a little bit more down, and you're going to get the anterior inferior iliac spine. You work your way to the back, you're going to have the ischium, right down here on the bottom, and right on the back side of that's going to be the ischial tuberosity, and then on the front part of that is going to be the pubis. All right. So, moving to the femur, you're going to have the greater trochanter, which is going to be right next to the head, and then you move down, and kind of medial, you're going to get the lesser trochanter. And then connecting those two is going to be the intertrochanteric line. And on the back side, you're going to have the intertrochanteric crest. And then also on the posterior side, running down the femur, you're going to have the linea aspera, which is just going to be like a bump right here. So the head of the femur is going to connect into the coccyx to form the coccifemoral joint. And then right here in the middle, that's going to connect the sacrum, and the ilium is going to be the sacroiliac joint. So moving on to muscles, we got the sartorius, which is going to originate into the anterior superior iliac spine, and it's going to insert into the pes anserine, which is down here. Do you want to just slide up more? Thank you. We'll get more room. All right. So next is going to be the rectus femoris, which is also going to originate into the anterior inferior iliac spine. Excuse me. It's not also. It's going to insert into the anterior inferior iliac spine, and it's going to insert into the tibial tuberosity. And both of those, the sartorius and the rectus femoris, both deal with hip flexion. Next, you got the tensor fasciae latae, which is going to be on the outside of the hip. That is going to originate in the outer lip of the iliac crest, and it's going to insert into the greater trochanter of the femur. So it's going to be that top bump. Next, you got the pectineus, which is going to originate into the pubis, and then it's going to insert into the pectineal line of the femur. And that's going to work with hip adduction, adduction. Then, right here, these tight cords right here, when you move your leg, your foot externally, is going to be the biceps femoris. That is going to originate into the ischial tuberosity, and it's going to insert into the head of the fibula, which you can feel right here. And that's going to work with hip extension. And on the opposite side, you're going to have the semitendinosus and semimembranosus. Both of those are going to originate into the ischial tuberosity, and the semitendinosus is going to actually insert into the pes anserine of the tibia, and the semimembranosus is going to insert into the medial tibial condyle. So when we did the knee, it's going to be on the inside, right there on that bump. It's going to be the condyle. So if you would, please move onto your side and slide down some, please. More towards me, thank you. So we got the gluteus maximus right here, which is going to originate on the sacrum in the coccyx, and it's going to insert into the gluteal line of the femur in the iliotibial band. So right above it, you're going to have the gluteus medius, which is going to originate between the iliac crest and the anterior and posterior gluteal lines. And it's going to insert into the greater trochanter of the femur. So it's going to wrap around to the front. And then underneath that, you're going to have the gluteus minimus. And that's going to originate in the anterior and inferior gluteal lines. And it's going to insert into the greater trochanter of the hip as well. Okay. The gluteus medius and minimus is going to work with hip abduction, hip abduction, and the gluteus maximus is going to work with hip extension. We also got the iliotibial band, which is going to originate in the iliac crest, so that ridge right up here again on the ilium, and it's going to insert into Gerdy's tubercle, which we touched on when we did the knee. And that the iliotibial band is going to also work with hip extension. So if you want to sit back up again.
Yeah.
And kind of maybe turn your legs this way. On the back, connecting into, there you go. In the back right here, which is going to start at T12, the origin is going to start at T12. That's going to be the iliopsoas, the psoas major, and that's going to insert into the lesser trochanter of the femur. So, like I said, the lesser trochanter is kind of hard to get to, but it's more easier to be more like right in here. And then, sit back up. Actually, sit back up. Thank you. Sorry I have you going every which way. And slide more down this way. All right. So, and then the last couple things I'd like to touch on is right in the front here, in the anterior part, where we have the pectineus, which runs across. Right below that, you're going to have the abductor longus. Below that, you're going to have the abductor magnus, and then the gracilis. So it kind of just like you're working inferiorly. And then in between the abductor longus and the pectineus, which is going to be kind of underneath it, you're going to have the abductor brevis. So the abductor longus and the abductor brevis both originate in the pubic bone, and they'll both insert onto the linea aspera on different thirds. So the abductor longus is going to be in the medial third, and the abductor brevis is going to be on the proximal third. And then the abductor magnus, which is up here, is going to be also connecting onto the distal. It's going to be inserting into the distal 1/3 of the linea aspera. And yeah, that's the hip.